All right. Let's open up to Unit 6. Unit 6. Got some good news and bad news here. Good news is we only got one section today. Unit 6 is the only one. The tough news, just in my opinion, I feel like that muscles are probably the most challenging units that we have. One, because you can look at all the illustrations you want, but sometimes it's challenging with the artist drawing up to see sometimes exactly where does a muscle attach. Secondly, with muscles, we got to know where the muscle originates and inserts, so basically where does it attach in the skeleton? What movements does it cause? Basically those two things, but especially origin insertions, they are very challenging. Additionally, the cadavers, which we're going to take a look at today, you're only able to see the cadavers during the lab. And there's a reminder that there's no pictures that can be taken of the cadavers, just due to respect for the cadavers. So this is the only time that you can actually see the muscles of the cadavers. So make sure to make good use of this time here. So the muscles we're going to look at is the muscle that move the axial skeleton. Can't even see that. So basically, the muscles that move the head, the neck, and the trunk. That's what we're going to look at today. To start with, these terms are not going to be quizzed on, but I just want to introduce them in case they come up in another class of yours, in case they come up in lecture. So to start with, muscles, they provide movement to the body. They help our bones to move. But the thing is, they don't push. Kind of like tug of war, they only can pull. Think of it kind of like a rubber band. They pull by contracting. Okay? So coming closer together, short. With muscles, as I mentioned before, we got two attachment points. The origin, origin, think start. The origin of human life, where did that occur? The start. That's the point on the muscle, typically, where 99% of the time, it's more proximal. Remember, that means closer to the center. And typically, it is less movable. Versus the insertion is more distal, further away from the center, and therefore, it is more movable. So for example, we got our bicep, muscle on our upper arm here. The origin is all the way up top here at the shoulder, because that is less movable compared to its insertion on your forearm, which we can move a lot. So origin, where it starts, insertion, where it finishes. Now, I mentioned contraction, movement of the muscle. There are three kinds of contractions in essentially the muscle producing force. Three different ways. First is isometric. I want you to think isolation. When you have an isometric contraction, that means your muscle is taut, but it's not moving anywhere. It's not shortening, nor is it lengthening. It's staying the same length. So essentially, I just had a dumbbell and I held it in my hand here. That would be an isometric contraction. Another example would be doing a plank for time. That would be an isometric contraction. Concentric contractions are the most common. That's when the muscle shortens. So as I'm doing a bicep curl, my bicep muscle is getting shorter. So that's concentric. Eccentric, that's the opposite. It's where the muscle lengthens. Think of an eccentric person. They're kind of far out there. They're on the fringes. Eccentric, lengthen. So those are the three different kinds of contractions that you're going to see. Now, when we're producing force, when we're moving something, we got what are called primary movers and then synergists. This is kind of an example I wanted to use. The primary mover, the dad in this case, produces most of the force. It does most of the movement. For example, if I'm doing a push-up, my chest muscles would be considered primary movers. because they're doing a lot of the movement. Synergists, okay, the kid in this case, they help a little bit with the movement. In this case, he's helping drive the car. But they don't produce most of the force. They just help out a little bit. For example, if we're doing a push-up, your shoulder muscle is a synergist. Okay? It helps a little bit, but your chest muscles are much bigger than your shoulder muscles. Therefore, your chest muscles are more the prime movers. Shoulder muscles are more the synergist. So prime mover does most of the lifting. Synergist just kind of helps. Lastly, we got agonist and antagonist. Agonist is kind of like the good guy. This is the muscle that is shortening, okay, or the muscle that's producing the force, producing the contraction. The antagonist, or the bad guy, okay, if the antagonist would contract the same time as the agonist, so I'm trying to do a bicep curl, but my triceps, the muscles on the opposite side, if they contracted too, my arm wouldn't go anywhere. So my triceps has to relax to allow my biceps to contract. So think agonist and antagonist, the muscles are on the opposite side. Agonist is the muscle that's doing the lifting. Antagonist is the muscle typically that does the relaxing. So again, this is just for your information, okay, for future classes, okay, or maybe even for the lecture portion. So now here we go. Now we start with the material here for Unit 6. Let's start with movements of the head and the neck. Now remember, this is about the axial skeleton. Axial skeleton. So let's start with extension and flexion. Remember, with the axial skeleton, flexion is always coming down. Extension is always going up if we start at the anatomical position. So tucking my chin to my chest, that would be neck flexion. Looking up at the stars, that would be neck extension. Next up, we got rotation, okay, turning our head to the right and to the left. Kind of like saying no. So those are rotational movements. Remember, any rotation movement, we're thinking transverse plane. So any movements that are rotations are going to be in the transverse plane here. Up top here, we can also tilt our head to the side. Okay? Kind of like, hey, kind of interested in something. This is in the frontal plane, or the coronal plane. Lateral flexion to the left or to the right. That's a frontal plane movement. So again, extension, flexion. That's a sagittal plane movement. Rotation, left and right. That's a transverse plane movement. And then we got lateral flexion, which is a frontal plane movement. This chart right here is for your benefit, but this is in the chart that I gave you at the beginning of class here. So make sure, this is at the back table if you haven't picked it up yet, but this is in there. This is included. This is just kind of a summarized view. These are all the muscles, and it tells what movements do they do. So for example, the scalenes muscles, they do neck flexion, and they do neck rotation. We'll get to those muscles in a little bit here, but that's just to summarize this for your benefit. Now, like the head and the neck, our trunk can do the exact same movements. If I'm bowing, okay, this would be trunk flexion, bowing down. Returning from a bow, that would be trunk extension. Again, this is sagittal plane movement. Sagittal plane. Right and left lateral flexion. Okay, side bends. Okay, this would be a frontal plane movement. And then we got rotation, left and right rotation. Same as with the head and the neck. Again, in the rotational movement, we're thinking transverse plane. And likewise, Again, this is a similar table that's also in your chart there that you just got. That summarizes those muscles that do those actions. And finally, because our lungs are located here, we've got respiration muscles. Now typically at rest, we've got our diaphragm. Remember, diaphragm, it's a muscle that's on the bottom of our lungs. It's kind of U-shaped. When it contracts, it becomes straight, okay, and it pulls the lungs down, allowing air to come in. That would be inspiration. Air coming in, inspiration. When it relaxes, it returns to its U shape, and that would be expiration. Air is exiting the lungs. Now, when we're exercising, though, our diaphragm is too slow. It can't keep up with the oxygen demands that our body needs. So we have other muscles that help with forced expiration, so they help us blow our air out faster. And there are muscles that help us to bring air in, to inspire it in faster. And we'll talk about those as well. And that is summarized on this chart. So any questions there with the movements that we're looking at? So we have movements of the head and the neck, we have movements of the trunk, and inspiration and expiration for breathing. Alright, so we're going to start the muscles here. But before we do that, I want to scroll to the end of our slides. These muscles, I want you to star them, I want you to underline. Take a couple minutes. These are all the muscles that you will need to know origins and insertions for. So star, highlight, whatever you need to do. Make sure you know the origins and insertions for those 7 muscles. Now for my class here, if I have a question on the quiz about these kind of origins and insertions, the way I'm going to set it up is matching. So I'm going to have a list of muscles on one side, and I'm going to have a list of sets of origins and insertions. They're not going to be separated, but the set of origin and insertion, and your job is to match. So maybe sternocleidomastoid, you match it with the origin and insertion for letter C. On your quiz, you're going to have 3 of those. So we're going to have 3 muscles listed, and we're going to have 4 sets of origins and insertions. So there's going to be one extra one that doesn't count. So your job is to match the origin and insertion with the correct muscle. But you won't have to come with it. You won't have to remember it out of thin air. It will be there for you. All right, let's start with the sternocleidomastoid. Now, like a lot of landmarks, some muscles are going to tell you where the origin and insertions are going to be. So the sternocleidomastoid, 3 words there. Sterno, meaning sternum. Cleido, meaning clavicle. And mastoid, talking about the mastoid process. Remember from last week on the skull, your mastoid process, okay, it's a bony part of that skull that sticks out. It's behind your ear. Mastoid process here. So, our sternocleidomastoid, it's going to originate at the sternum, specifically the manubrium. So if I'm looking down here, here's the manubrium. Okay. Its origin, okay, is going to be the sternum, specifically the manubrium. And it's going to be on the medial portion, okay, closer to the midline, of the clavicle. Remember, clavicle is like your collarbone. We'll talk about that in the next one. So those are the 2 origins. The insertion is all the way up at your mastoid process. And in fact, this muscle here we can actually feel on ourselves. So if you take your fingers, okay, kind of find your jugular, Adam's apple if you've got it, and go to the one side. Grab a big honk of it. That's your sternocleidomastoid. Now this muscle can do a lot with the head and the neck. Okay? It helps with neck flexion. So if you bring your chin down, notice it contracts. So it helps with neck flexion. Also helps with lateral flexion. So coming off to the side there, helping out with lateral flexion. If I twist my head side to side, it helps with rotation too. But now it's a little different than what you kind of think. So it's on the right side, so a lot of times you would think, oh, it's going to pull it to my right. But the sternocleidomastoid is the opposite. So if I turn my head away, okay, I feel it contract. And that should make sense. This might help with that. So I'm starting here. Notice that my sternocleidomastoid is at an angle. If I want to straighten it, okay, so it's going to contract. It's going to pull these fibers instead of lying at a diagonal. It's going to pull it towards up and down. Notice how these muscle fibers are shorter than this. Okay. And so in order to do that, it's got to look away from that sternocleidomastoid muscle. So it's going to rotate it to the opposite side. And finally, it also helps with forced inspiration. Coming in. And that's because if you notice here, okay, it's staying at the clavicles, helping bring the rib cage up, helps your ribs expand. So it's also going to help with forced inspiration. Next one, scalenes. Scalenes. Any math nerds in here? Remember, a scalene triangle has 3 sides and none are the same length. So likewise with the scalenes, we've got an anterior, medial, and middle and posterior scalene muscle. So we've got 3 of them, and they are all different lengths. Now, this is very similar to the sternocleidomastoid. The fact that it does help with neck flexion as we talked about. It helps with neck rotation, but this time it's to the same side. It's going to rotate it to the same side. And finally, based off this little insertion points, it's also going to help with forced inspiration. Notice it's on its first 2 ribs, so it helps bring the ribs up, which helps expand the rib cage, helping you with inspiration. So coming up there. So its insertion points, which we need to know here, are on your first 2 ribs. Okay? And then originates at the transverse processes of the cervical vertebrae. So those 2 muscles here, in general, they help with neck flexion. The reason why I want to emphasize that is these next 2, the 2 splenius muscles, they help with the opposite. They help with neck extension, help bring that head up. Now the wording, again, hopefully helps you understand where these muscles are. So splenius cervicis, thinking cervical vertebrae. So notice here in green, okay, it's going to insert the transverse processes of the first 3 cervical vertebrae. It's going to insert up there. And that's going to originate, come all the way down, okay, to thoracic vertebrae T3 through T6. So here's the origin, T3 through T6. and it inserts at cervical vertebrae C1, C2, and C3. Now the big difference is splenius capitis, cap, thinking a cap on your head. This one inserts all the way up at the top on the skull. Okay? A cap is on a skull, okay? So it all inserts all the way up there. And if you notice, it's hard, I don't think this is going to, no, it's dead. But if you notice here, you've got this line. We call this the knuckle line. N-U-C-H-A-L line. So it's going to insert at the superior portion of that knuckle line. It originates there all the way down at vertebrae C7 through T4. So the last cervical vertebrae all the way up to the fourth thoracic vertebrae. Now, nice thing with these ones, these both help with neck extension. Neck extension. I'm pretty sure that's it. Yep, those are the only movements that it causes. So the splenius muscles, if you remember, they both help with neck extension. That'll help out. And it should make sense. Notice these are on the posterior side. They're on the back of your neck. So if I got a rope on the back of my neck and it comes together, my neck has to extend. Likewise, when we're talking our sternocleidomastoid and scalenes muscles, they're more on the front. Okay? So if I'm pulling down on the front, it's going to help with the neck flexion. So if you know generally where these muscles are located, it should give you a good idea of what movements it does. You don't need to necessarily just memorize the movements straight up. If I follow the direction of the muscle fibers, knowing that they're going to come together, they're going to shorten, that should give you an idea of at least some of the movements, if not all of them. Moving down, we're going to introduce some torso movements here, okay, with our erector spinae, okay, erect spine. Kind of one way to help remember it. These are a set of 3 muscles on the posterior side of your body, on the back side. You will not need to know origin and insertions for these because there's just so many. You've got 3 different muscles, the iliocostalis, longissimus, and spinalis. You will need to know what the names of these 3 muscles are that make up the erector spine. But essentially, all 3 of these muscles, they originate and insert all the way, okay, up the neck, down the spine, and even attach at some of the hip bones. And so because of this, this muscle here does pretty much every action of the torso and the neck, except for flexion. So it does not help with neck flexion. It does not help with trunk flexion. And that would make sense because it's on the back side of the body. Also, it does not help with forced inspiration or expiration. So you don't have to worry about that. But every other movement, okay, the erector spinae helps with. Let's move over to the anterior side of your trunk, the front side. I'm going to talk a little bit about abdominals. Let's start off with everybody's favorite, rectus abdominis. This is your 6-pack abs here. Big old set of muscles. You will need to know origin and insertion for this one. It starts down at the pubic symphysis, right down here, originates, comes all the way up and inserts at costal cartilages 5, 6, and 7. Remember, costal, meaning rib, cartilage. So the rib cartilage right here, that's where it inserts on, as well as the xiphoid process up here. In the rectus abdominis, if you think crunch, that's the only motion that it does. So it helps with trunk flexion. And again, it should make sense if you look at where the fibers are running. not really off to the side at all, so it can't help with any rotation or lateral flexion. Okay? The only thing it can help with is flexion. So rectus abdominis, your six-pack abs. The next two, these are your oblique muscles. Okay? And these muscles run from the front, okay, and partially around to the side. The difference between the external and internal oblique are the way the muscle fibers run. Notice external oblique, those fibers are coming down and in, kind of like you're putting your hands in your pockets. Hands in your pockets there. Internal obliques are the exact opposite. Okay? They're coming up and in. Up and in. The reason this is called external and this one internal is the internal obliques are deep or are underneath the external obliques. So the external obliques lie on top. So with our external oblique there, we're taking a look. Okay? It's going to originate all the way down here at the lower 8 ribs. Okay? So right up here, lower 8 ribs. And it's going to insert at the linea alba. Okay? The linea alba is a line that goes directly down your stomach. Okay? It's a piece of connective tissue. So the linea alba here, and as well as the anterior portion of your iliac crest, okay, which is right here. So the external oblique, let's think about what motions does it do. So if I'm coming down and in, so pretend these are my muscle fibers, okay, I can do trunk flexion. I can come to the side. That's going to be trunk lateral flexion. And I can do trunk rotation. Okay. Now this is like the sternocleidomastoid. Okay, so make a note of this. Where if I contract it, okay, it's going to rotate me to the opposite side. So my right external oblique, if I contract it, it's going to turn me to the left. Finally, okay, this muscle also helps with forced expiration. So if I blow my air out really fast, okay, external oblique is going to help me out with that. Internal oblique, its movements, okay, do the exact same thing. Exact same movements there. So nothing different. The only difference, though, is rotation is opposite, so it's going to be to the same side. Okay, because again, my muscle fiber is coming up and in. So if it contracts and shortens, I'm going to twist to the same side. I'm going to rotate to the same side as that oblique muscle. This muscle originates at the iliac crest and the inguinal ligament. Then inserts all the way up at the top. Costal cartilages, ribs 9 through 12, as well as the linea aspera. So it helps out with that as well. Last two. Don't need to know origin insertions for these. But the name again gives it away. Costal, meaning ribs, and inter, meaning between. Between ribs. And so these muscles are between your ribs. External, they lie on top of the internal intercostals. Now their actions are the opposite of what's named. So I'm thinking intercostal starts with the letter I. You would think it would be inspiration, but no. internal intercostals, they do forced expiration. So they do the opposite of what you would think. Essentially what they do is they're going to pull down on the ribs. Pull them down. Scrunch up kind of like a corset, pulling down. External intercostals, that's the opposite, where they're going to pull up, help the rib cage expand. So they help with forced inspiration. So any questions there about any of those muscles? Again, I would encourage you to take a look at these links. For most of them, again, I tried to provide a video that showed the action when possible, so you can kind of see them moving in real time. So you've got that. Make sure we star these ones. In a moment, Marcia and myself are going to show you these 6 muscles on the cadavers. These are going to be the ones next week you're going to come in. We're going to walk to the cadaver and there's going to be a pin on that muscle. And so you're going to need to make sure that you can write and spell these correctly for up to 6 of these muscles. A couple points I want to point out. I don't need you for the cadaver portion to tell me which of the 3 Erector spinae muscles it is. Now you will, 99% sure, will have to know what the 3 Erector spinae muscles are. You need to know their names on the quiz. I think the question is, which of the following is not an Erector spinae muscle? So you will need to know all 3, but just not on the practical portion. Likewise, intercostal muscle, okay, I don't need you to differentiate between external and internal. Although, because we pretty much only see surface muscles, okay, you would know that they would be externals. The external intercostals are on top. But again, I'm not going to be picky with that.
So if you said external, it would be wrong?
No.
As long as we just said intercostal?
Yeah, and if for this portion, if you said internal intercostal, I wouldn't mark you off for that. Just say intercostal, you're good to go with that.